Insulin resistance is a growing health issue worldwide. It affects millions and can lead to serious health problems. Many people do not realize they have it. Early detection is important to prevent complications. Insulin resistance is linked to obesity, high blood pressure, type 2 diabetes, and heart disease. Let's start with what insulin resistance is. Insulin resistance occurs when the bloodstream is overrun with glucose. The body will issue the hormone insulin that will trigger the body to store the excess glucose in the fat cells. The remaining glucose will be burnt for energy, as it is actually toxic if it remains in the bloodstream. If the body is consistently exposed to elevated glucose levels, common in the standard Western diet, with its added and hidden sugars, cells may begin to develop insulin resistance. This leads to glucose accumulation in the bloodstream, prompting the release of more insulin, which can further exacerbate resistance, creating a cycle that becomes increasingly difficult to control. As the pancreas works harder to produce more insulin, the body is forced in to storing more glucose, leading to obesity and eventually type 2 diabetes. Now, let's see how it develops. Insulin resistance develops gradually. Step 1. The body consumes food, sugars, starches, and other carbohydrates are broken down into glucose. Step 2. When the glucose levels rise, the pancreas releases insulin to help excess glucose enter cells. Step 3. Cells start to resist insulin, making glucose entry difficult. Step 4. The pancreas produces more insulin, but blood sugar levels rise. Step 5. Over time, the pancreas cannot keep up, and blood sugar levels stay high. These steps show how insulin resistance affects the body. Now, let's look at the causes and risk factors. Several factors contribute to insulin resistance. Obesity, especially around the abdomen, increases the risk. Poor diet, including processed foods that are laden with hidden sugars, such as glucose, fructose, lactose, galactose, and sucrose, as well as the lack of physical activity, also play roles. Genetics matter. If your parents have it, you are more likely to develop it. Age is a risk factor, as it is more common in older adults, but that is also because of the time it takes for damage to manifest itself. Hormonal changes, such as during pregnancy, can affect insulin sensitivity. Understanding these causes helps in managing the condition. Next, we will discuss the symptoms and diagnosis. Insulin resistance often has no obvious symptoms. Common signs include fatigue, hunger, and belly weight gain. Dark patches around the neck and armpits can also indicate it. Diagnosis involves tests like fasting, blood glucose, and oral glucose tolerance. The hemoglobin A1C test shows average blood sugar over 3 months. Early diagnosis is crucial to prevent complications. If you have risk factors or symptoms, consult a doctor. Now, let's explore the complications of untreated insulin resistance. Untreated insulin resistance can lead to serious health issues. One major complication is type 2 diabetes. High blood sugar levels damage the body over time. Another complication is heart disease. It can lead to high blood pressure and cholesterol. Kidney damage is also a concern. Insulin resistance can cause nerve damage. Managing insulin resistance can help prevent these complications. Next, we will look at ways to manage and prevent insulin resistance. Managing insulin resistance involves lifestyle changes. Diet and exercise are key. Focus on single ingredient whole foods that are low in carbohydrates and especially sugars. Be mindful of some fruits as they are high in sugars and fructose. Especially avoid processed foods that have hidden sugars and processed oils. Eat nutritionally dense foods like red meats, animal fats, and exercise regularly, aiming for at least 30 minutes most days. Remember, walking is exercise. Physical activity helps cells respond better to insulin. If you are obese, then eating a low-carb diet will help with losing weight. That in turn can also help improve insulin sensitivity. Monitoring blood sugar levels is important. Regular checkups with a doctor are crucial. They can help manage the condition and prevent complications. Understanding insulin resistance is vital. Early detection and lifestyle changes make a big difference. Education empowers people to control their health. Small changes in diet and exercise have a huge impact. Awareness helps reduce insulin resistance. Communities support healthier choices. Seek professional medical advice. Doctors provide personalized guidance. Professional medical advice is essential. Doctors can diagnose insulin resistance early and provide treatment options. Regular checkups help track blood sugar levels. Personalized advice leads to better outcomes. Take control of your health. Understanding insulin resistance is the first step. Thank you for watching our content, and it would be great if you could like and subscribe, as it helps the channel to reach a wider audience.